I want to welcome you all, and maybe one way to do that is to ask you to introduce yourselves. So who would like to go first? Mariya?
Sure. Hi, everyone. My name is Mariya Klimenko. I'm currently working in the TriMet Equity and Inclusion Department. I have a history of working with immigrant communities, and I'm a former refugee myself.
Thanks, Mariya.
Good afternoon, everyone. This is Alberto Moreno Martinez. I say Martinez because I'm not just my father's son, but also my mother's son. I am the director for the Office of Equity and Multicultural Services at the Department of Human Services. We say Department of Human Services these days because the acronym DHS has multiple non-trauma informed meanings at present in many of our communities. And so we like to distinguish Department of Human Services from the Department of Homeland Security. It's lovely to be with you today.
Buenas tardes, my name is Ursula Loret de Mola. I am currently a teacher at Alliance at Benson. We are an alternative program that serves Portland public students who have not been successful in traditional campuses. And so our work is really based on trauma-informed care too. I'm an immigrant as well. And I've been an educator. I grew up in the San Francisco Bay Area, and so I've made my way through different districts and different programs, nonprofits, and education programs.
Nice, thank you all. I'm really excited to share space with you. So let's just begin with talking about the concept of diversity, equity, and inclusion. And I say concept at this point because, you know, you say that word or the acronym DEI in a room full of 50 people, you get 50 different definitions and personal relationships to it. So tell me about what it means to you for the notion of DEI and the quote unquote concept of DEI, the work of DEI, to be present in the workplace, especially at a time of incident response.
Sure. I mean, it goes as simple as just being seen. For me to be seen in the workplace as who I am, and that's very different layers. You know, starting from how do I present to my coworkers and to my students and to my community, my accent, my ability to navigate different languages in different communities. You know, and so I think I bring forth. I'm someone who brings her person first, and so in the work that I do is really important to like be vulnerable and to be genuine with my students so that I can build relationships with them. And so I think that works for me too. And so having a workplace that sees me, you know, that understands that family is an important cultural value for me, and that a lot of the decisions that I'm going to be making are based on my family and in my community. And so that's how I began to think about diversity and inclusion. As an educator, I'm an ethnic studies major. I come from the Racial Studies department at San Francisco State. And early on in my career, one of the things that I was taught was to look at students from a strength-based perspective. And so that's another tenet of like my work and how I like to be seen. And so, you know, what are the strengths that I bring to the plate or to the community that I'm working in? And you know, that also includes understanding the trauma that I have lived through, whether it's just immigrating, the different types of immigration in my community, et cetera, you know, family dynamics, whatever else I bring to the plate. And then when I think of inclusion, I think of like people's different abilities. And I'm so glad that you talked about like captions. I'm very sensitive to kids who have different needs in the classroom, whether they're mental health, you know, behavioral, you know, even like physical needs, right? Hunger. I think a lot about like, as a Spanish speaker, as a native Spanish speaker, I also think about people who are who speak sign language. And you know, and the similarities and how often we exclude people who are hard of hearing or who are blind. And so thinking of all that comes up for me when I think about diversity inclusion in the workplace. And so as a teacher, I first think of my students and their families, but it also applies to me. I'm my father who just had a heart attack, you know. I'm my mom who is an interpreter in community clinics and also sells like Mary Kay at some point, and she knows everybody and their mamas, you know. And so I bring that to the table and to my students. And so, yeah, that's you know, just seeing people for who they are and what they bring, and not to make generalizations.
Yeah, thank you. Mariya, what does this bring up for you? Intersection of DEI and workforce wellness, especially at a time of incident response.
Yeah, well, I think that the point that Ursula made about being seen is really important. And I would also add to that with your experience being acknowledged. So I'm from the Slavic community. I'm also a person who is, I guess, mixed ethnicities. I have a Cuban father, Ukrainian mother. And I think that oftentimes we have a very preconceived notion of what equity and diversity means. I would say almost it's akin to a brand, and people think of it as looking a certain way or having a very specific experience. Because I work a lot with refugee and immigrant populations. I mean, personally, I was motivated to get into this work based on my own experience. I came here as a child when I was about 10 years old, and you know, I always felt like I didn't quite fit in very well. I didn't feel a sense of belonging, but I couldn't really articulate very well why. And I think that part of it is cultural for us, right? There's definitely a sense of stoicism in the face of problems, not complaining, not really taking the time to think about your mental health, and sort of always focus on the thing that's immediately in front of you, meeting your basic needs. And I also think that, you know, as people who physically present the way we do, I do think that we tend to get excluded from conversations around equity and diversity, when in fact there are pretty big disparities within the Slavic community or people with a refugee background. And I think that's especially apparent now, because what can be for some people an inconvenience, you know, really brings up a lot of refugee trauma triggers, particularly when you look at things like food shortages. So I think that can run a lot deeper than maybe people who belong to the mainstream population can quite understand or acknowledge. And that being said, I think that we tend to put people into easy to dissect categories. So, you know, you're either one thing or you're another thing. And I think, at least in my particular experience, it's always been difficult to represent or belong to several different worlds, right? Because when people look at me, they probably don't think Latina right away. So I think that there's a lot that we miss just by looking at people on the surface level. So that's why, to me, the work of diversity and inclusion is really nuanced. At the same time, I think that there's a lot of historical, legal experiences with communities of color that run very, very deep. And there's certainly a difference between things that we've experienced as maybe newer immigrants, as opposed to people who have faced historical oppression. And so I think it's an opportunity to learn from each other's experience and come together in areas where we can truly understand one another. And another thing that I wanted to add is, I think that people sometimes mistake diversity and inclusion work as a one-size-fits-all approach. And I think if you're dealing with a person who is from the African American community as opposed to a Somali immigrant, you know, there's certainly a common experience of what it feels like to be marginalized, but there's also very specific traumas and experiences that are unique to different people. And so as convenient as it is to talk about, you know, the Black community this, or people of color that, immigrants this, refugees that, I think it's really important to also acknowledge people's unique experiences as well as their collective ones.
So many fine words of wisdom from Mariya and Ursula. What else you got, Alberto?
It's hard to add any more wisdom than they've already shared. Thank you to both of them. You know, I think diversity, equity, inclusion, and accessibility is especially critical during this time, because I think it's tempting for systems and structures and organizations, especially dominant system organizations, to think of that work as a burden, as an add-on to what are already full plates. But I think we need to look at diversity not as weakness, but as strength. That is that in Oregon, we're great, not in spite of our diversity, but because of it. Because our survival as a species depends on that rich genetic and cultural diversity. We know that our communities portage great resilience, especially as I hear my colleagues talk about immigrants and refugees. They come not only with great need, but they also portage, I think, wonderful, culturally imbued strengths, which are rarely talked about or recognized. For example, we know that the science is beginning to show that those first-generation Latino immigrants who arrived in the US have better health outcomes than their second-generation born counterparts, meaning that there's something about our diets, there's something about our traditions, something about the way that we are structured as families and extended families, something about the way we pray, something about the way we walk in the world, something about our relationship with the environment that has culturally imbued protective factors that make us not weaker, not a liability, but an asset and a strength in these times. And so the challenge, the opportunity for our dominant system friends and allies is to not see us alone as disease vectors, to see those curative elements, those transformational elements that we carry in the very sacred helix of our DNA, which make us collectively as communities stronger. And so that is both the challenge and the opportunity. And I think it's also an invitation to our friends and allies to look at this differently, to see us as value added, to see our many beautiful strengths. Thank you for asking.
Yeah, thanks for that. I'm curious if there's specific examples, especially these days, that you could share with us, both intrapersonally or interpersonally, or actually organizationally through policy or procedure, examples of, you know, DEI in action in a way that supports the wellness of the workforce.
You know, intrapersonally, for me as a white-looking Latina, I think it's important to see who, you know, whether to check myself and be self-reflective and making the judgments, right? So whether it's, you know, I see youth hanging out on the streets, or a single mother taking her baby to the store without wearing masks, you know, I need to be able to check my judgments in terms of workplace productivity, whether I'm motivated to work or not. In my head, I'm like, oh, no seas floja. It's just the idea of an immigrant always producing, always working. I was having a conversation with a really good friend of mine who's a mental health provider in the San Francisco Bay Area, and she was talking about how, as a provider, she has to continue. She feels like she has this need to continue to work and work and work because she's a first-generation immigrant, and she needs to produce, not only to prove to like herself and her community, but there's also the idea of like that we have no choice but to continue to produce and continue to work because we have no idea of what's going on. And so I think interpersonally, I also tap into some of the traditional knowledges that I've been able to acquire or to learn. I listen a lot to what some of the native elders are doing, try to understand more about the traditional teachings. Interpersonally, I'm really blessed to have this class where I work with a local musician and the history teacher. So we have this class that we call Voces. And it's really about taking what the kids want to talk about and bringing it into the classroom and into our space. And it's the only community-based class that we have in our program. And it's been the only class that we're successful in continuing to have attendance. And the kids are going there for community, and they're going there to talk about things, right? And we always ask them what they want to do and what they want to talk about. And what they want to do is do art. What they want to do is talk about being inspired. They want to learn about their traditions, their ancestors, their history. They want to learn about what else is going on in the world because they're really actually just exhausted from hearing so much about, COVID-19. And as I was preparing for this, I got really excited because then we could talk, I could prepare curriculum about addressing the disparities in the Latino community in health and education, et cetera. And I'm ready to plan curriculum around COVID-19. They don't want to talk about that. And so I think, intrapersonally, we have a lot of work in checking ourselves, being patient, and because we also have to model it interpersonally in our work. I work with kids. So when I used to work with adults in nonprofit, I have to be a model of like, being able to acknowledge that my mental health is not 100%. And then how do I negotiate? And I had a student last week bring up how he's been depressed. So it was important for us to also take a moment to say, hey, you know what? Look at the growth that you have done, and you're here today. And you're coming to class and you're showing up. And so I think it's also a lot about like interpersonally taking the time to acknowledge the work that you're doing to show up, however you're showing up in your life, and also to model that for those who you're working with and you're working for and you're working, you're teaching, whatever, however you're involved in the community. And I think especially as first generation immigrants, we also are interpreters in our community. We're sharing information, we're helping people access resources, and we immigrant and refugees communities, we have a lot of taboos around mental health. So even having conversations that, hey, let's talk about our mental health, my dad will tell you that he's not crazy and he doesn't need help. And so, but how does his behavior then affect me? And then how do I show up at school? And so I think it's a moment to like slow down, talk to people, take breaths, and like you said, just kind of acknowledge what's going on in your body, and just try to like process. I think.
Yeah, well, I just kind of wanted to talk about, and I think it's a little bit related to Alberto's point earlier, when you look at health outcomes for second versus first generation immigrants. And to me, it's kind of having a very standardized expectation of behavior. What does it mean to be safe? What does it mean to be healthy? What is your community's relationship to the government? So I think when we look at the way that resources are being distributed during this crisis, the way that information is coming out, sometimes people think that just having language accessibility is enough without really examining the things that you're asking people to do and how that's going to resonate in that community. And I think a lot of it has to do with, I mean, let's start with what it means to be healthy. What does it mean to have a healthy diet, right? I think that things like a lot of the nutritional education programs I've seen, or the way that doctors approach health, right, has to do with getting vaccines or eating kale or eating these trendy foods without really taking the time to learn from communities what are some of their traditional healing practices, and what kinds of foods do they eat to stay healthy. And it doesn't always match with, I think, what is the mainstream expectation of what it means to be healthy, right? And all these things are relevant as we're going through this crisis in the way that people take care of themselves. And so I think that also translates to the idea of safety, right? Like, what is your relationship with police, with security officers, and how willing are you going to be when you go to a park, right, to respect the authority or to take seriously what a park ranger is telling you. And so I think a lot of the communication methods have really been with the intended audience of what we consider like, you know, the mainstream hipster liberal Portlander. And we're kind of assuming that people have these same expectations of behavior. And so I do think it's really important to know the community that you're working with, so that you understand exactly what barriers you might have to have a dialogue and explain the message from a perspective that they can better relate to, as opposed to just having a mandate. And I think we can see that too in the way that some of the schools are implementing the distance learning piece, right? It's not only thinking about families that maybe don't have access to technology, that don't have access to internet, that are not as literate. And also, I think in immigrant families, you know, for a lot of our communities, people who are elderly really have a position of respect, right? And so when you take these new technologies and rules and relationship to government and school, where the kids really take on that role almost of being the adult, what that does to the family structure without providing a space for elders to kind of exercise their respected role as leaders, as experts in their community. And so I think it's really important to make space for things like that. So as an example, when we were doing the hunger relief program at the Immigrant and Refugee Community Organization, when we did the nutritional education aspect, we really tried not to have different institutions come in, like Oregon Food Bank or health organizations, to talk about, you know, what a healthy diet might look like. We always tried to have folks from the community who were a particular age to come and talk about how they see healthy meals, to share traditional recipes, to really give them a space to kind of own their expertise and their knowledge, as opposed to being lectured by someone. And so I think that approach can really be recreated in a lot of different ways, right? Extending to not just to health, but other things. And I think that dialogue and really making the space for people to be heard and to kind of restore their sense of, you know, I think Alberto, you said value added. And I think that piece really gets overlooked. We talk about these communities, I think a lot of times in a top-down approach, without giving them as much space to share what they have to offer and their perspective.